zygomatic gland, when it is enlarged, we said that it will displace the eye dorsally, so the eye is pushed up out of the socket, and when we open the mouth itself, then the ramus can place pressure on the zygomatic gland, causing some discomfort. Once again, we're going to place the animal in lateral recumbency with the affected side uppermost, and we're going to clip and prepare the area of the skin aseptically and apply a drape to that area as well. We need to make an incision over the zygomatic arch through the skin and reflect the skin ventrally, and then we need to make an incision through the attachment of the masseter muscle to the zygomatic arch so that we free the muscle altogether and retract it away. It's sometimes necessary to cut a piece of the zygomatic arch bone itself out so that we can get easier access to the gland. Once we've removed that, we can find that the infraorbital fat pad becomes visible straight away. And after we've removed some of that fat pad, we will see the gland sitting just on the medial aspect of that. We can retract the gland by gentle manipulation with forceps, so we can gently loosen the gland up and dissect it until it comes out altogether, and we can then free it up. Please remember that if we have a neoplasia in this area, we're going to need a wider resection than we normally would to try and get clear margins. But once again, because the tissue is sitting beneath the eye and up against the bone, it's unlikely we're going to get a clear margin without being quite radical. And in some situations, it may be necessary to use another form of treatment, and that might be radiation therapy. But we need to be careful because, once again, the eye is going to be within that field. We need to differentiate other structures that might be in the area and causing problems. And the next case is a case of a fat tumor. This is credit to Professor Verstraete and his team, where we can see that they did a CT on the animal. You can see this massive area here, this enlargement, where we'd expect to see the zygomatic gland up here. So this could be a zygomatic gland tumor, but when it was found to be a fat cell tumor that was resected, fortunately they could shell it out completely, and the animal resolved, and this is 4 months after the surgery. So you can see a massive enlargement here and confirmed on the CT. But we need to differentiate that from the salivary gland. We mustn't think that because there's an enlargement there that it is going to be typically a salivary gland, because we might go in, take the salivary gland out and find that we haven't resolved the problem. Just a reminder then of our zygomatic gland. The zygomatic gland is situated on the medial aspect of the zygomatic arch itself. This is the zygomatic bone, and this is the ramus of the jaw. And we said the ramus will apply pressure when the jaw is open. So to get access here, sometimes we need to take a window out of the ramus itself, of the zygoma, and we can do that either using an osteotome or using a saw or a high-speed or a low-speed drill. We need to be careful when we are operating in this area, once again, because we have blood vessels and nerves that are in here, and as long as we're down to the bone itself, so if we reflect the periosteum off of the bone, we can cut through the bone directly, but please be careful when you do this, because medial to that we have the eye. So just make sure that when you're cutting here, that your instrument doesn't go beyond the inner cortex of the bone and damage the soft tissues that are there. The next set of photographs are, once again, in credit to Professor Verstraete and Dr. Lohmer, and they're from their book, Oral and Maxillofacial Surgery in the Dog and Cat. And this, you can see, is where an incision has been made through the skin, and the skin has been reflected here, so that's the incision over the zygomatic arch. You can see here that they've made an incision through the aponeurosis of the masseter muscle. So they've loosened up the muscle at this point, and then we'd reflect the muscle completely to expose the bone, and then we can cut the window into the bone. And you can see that that window has been cut here, and we can remove this piece of bone. And this then, once we've removed some of the infraorbital fat pad, we can see the salivary gland, and then by gentle traction and blunt dissection, we can loosen the salivary gland up and remove it from that area. Again, just to summarize the surgical sites that we're going to be dealing with, we have our parotid gland, which is V-shaped at the base of the ear, and we have two structures that are important, mainly the facial nerve that comes out near the horizontal ear canal, and when we're doing surgery in this area, we need to make sure that we not damage that facial nerve, because you will end up with facial nerve damage symptoms in the front part of the face. So parotid gland with its duct that runs up through, comes out at P4 in the mouth here. And then we're going to have the mandibular gland, which is this one. And the mandibular gland has a duct that runs underneath the tongue and has a punctum that comes up over here, and it is going to be the rostral one if there are two of them. The polystomatic part of the sublingual is here, and the polystomatic will have ducts that might join the monostomatic, so this is the monostomatic gland here, and they might join together and empty at the front, and some of the other polystomatics will empty directly into the mouth, as we showed you in the first lecture, where the puncta actually open up in the floor of the mouth, delivering the saliva there. So when we're going to do surgery for a ranula or a silostool that is in this area, we need to surgically excise all of these glands here. So the polystomatic, monostomatic, and the mandibular gland in one, because they share a capsule. And finally, the zygomatic, which we have over here, we said it's ventral and medial to the zygomatic bone. You can see the window has been cut through the zygomatic bone completely, and we have the gland in this position here. So remove the bone, take away some of the fat pad, gently retract the gland, take it out, and then suture it closed. Please remember, all these animals need local anesthesia before the surgery is commenced, and also after the surgery they need some form of pain relief. It is something that is uncomfortable, and if they scratch at the face, they can traumatize the wounds that are there. Okay, and that's it. Are there any questions?